class. My name is Miss Ego Florence Okeke. I'm going to lecture you on this Nursing IHcm 115, Foundation of Nursing 1. Introduction, Chapter 1. Let's define what is nursing. Definition of nursing. Nursing is the profession within the healthcare sector focused on the care of individuals, families, and the communities, so they may attend, maintain, and recover optimal health and the quality of life. Nurses may be differentiated from other healthcare providers by their approaches to patient care, training, and the scope of practice. Nurses practice in many specialties with different levels of prescription authority. Nursing comprises the largest component of modern healthcare environments, but there is evidence of international shortages of qualified nurses. Many nurses provide care within the ordering scope of physicians, and the traditional role of shapes and the public image of nursing as care providers. Nurse practitioners are nurses within a guaranteed degree in advanced practicing nursing. Nurses develop plan. Nurses develop a plan of care, working collaboratively with the physicians, therapists, the patients, and the patient's families, and other team members that focuses on treating illnesses to improve quality of life. Nurses may be coordinated or coordinate the patient care performed by one member of the multidisciplinary healthcare team, such as therapists, medical practitioners, and the dentists. Nurses provide care both interdependently, for example, with or with physicians, and interdependently as a nursing profession. Nursing encompasses autonomous and the collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. This aspect is talking about that nurses can take care of people of different ages. At times you may go to hospital, you may see elderly people. Nurses of different ages. That's why nurse don't need to be aggressive. Nurses include the promotion of health, prevention of illnesses, and the care of disabled and dying people. There are other definitions of nursing. Nursing as an integral part of health, an integral part of healthcare system, encompasses the promotion of health, prevention of illnesses, and the care of physical ill, mental ill, and the disabled people of all ages in all healthcare and other community settings within the broad spectrum of healthcare, and the phenomenon of particular concern the nurses as an individual, family, and the group of people respectively. The unique functions of nursing in caring for individuals. The unique functions, that's completeness, the unique functions of nurses in caring for individuals, sick or well, is to ascertain the response to the health and the status, and to assist them in performing of those activities contributing to the health of recovery. That is, nurses need to educate them, the one they know and the one that they're supposed to know because of their health, so that they will be able to take care of themselves in absence of nurse. In a situation whereby there is no nurse, they may be able to take care of themselves. Let's go to chapter 2. 14 components of Virginia's theory. Chapter 2. Henson's and the Florence Nightingale nursing theory. Henson's and the Florence Nightingale nursing theories. 14 components of Virginia Henson's need theories. First of all, number 1, breathe normally. In this respect, normal breathing is very, very essential to human life. Secondly, eat and drink adequately. You eat at the right time and drink, more especially, plenty of water in order to digest your food, make your blood circulation, not have blood clotting, and eat quality of food. Eliminate body waste. Eliminate body waste. Go to toilet at the right time. Urinate at the right time. Number 4, move and maintain desirable posture. In this aspect, it involves PhD, physical and health education. You will be able to do normal exercise, rest at the right time, apply correct sitting position so that you will not have problem. Sleep and rest. Sleep at the right time, rest also at the right time. Normal sleeping, rest at the right time. Select suitable clothes desired, clothes and under. Dress. Be able to wear good clothes, look good, look smart. Maintain body temperature within normal range by adjusting clothing and modifying environment. Normal temperature. You need to live in a very good environment. You need to maintain the normal temperature. Number 1 is keep the body clean. You need to keep your body clean. Take your bath, more especially morning and the night, and avoid dangerous objects. You'll be able to avoid some things that will be able to harm an individual, like pee and others that fall into this group. Communicate with others in experiencing emotion, need, fear, or optimal. Be able to have good relationship, good rapport in aspect of communication, so that when, as a nurse, you don't need to be aggressive. As a nurse, when somebody would like to talk to you, that person don't need to be fear, don't need to be afraid, don't need to have bad feelings because of your aggressiveness. Another one, worship according to the one's faith. Very significant in all individuals. According to one's faith, in this respect, fundamental human rights need to be applied. Freedom of worship. You have freedom to worship according to 14 components of Virginia Henson's need theory. The other one is play or participate in various forms. Sports. You play in various forms. You're able to be agile. Another one is learn, discover. That is scientific research, different types of research to be able to know the best for you. Henson's nursing theory. Henson defined nursing as the unique function of the nurse is to assist individual. Henson said that the unique functions of the nurse is to assist individual, sick or well, in the performance of those activities contributing to health or its recovery, or to be peaceful, those that are dying peaceful death, that he will be performed what unavoided. If he had necessary strength, will be acknowledged, and to do this such as the way help him gain independent happy and possible. Her theory had four major concepts. The basic needs, that's basic needs of the individual, basic need, the environment in which individual lives. In this aspect, environmental factor, the definition of health of an individual, ability to function independently, and the basic concept of nursing carried out by nursing in caring for the patients. In caring for the patients. Florence Nightingale's environmental theory. Florence Nightingale's environmental theory. Florence Nightingale, mother of nursing. The mother of nursing. Florence Nightingale was born on May 12, 1820, while her parents were on an extended European tour. Much attention has been to the caring that Nightingale recorded in her diary in the year 1837, which she wrote that God spoke to me and called me to this service. In this aspect, it's in form of revelation that God spoke to her either through dream or through other source to be able to be a nurse in form of calling. That is, calling is her talent. Florence Nightingale began her nursing training in 1851 in Germany. She pioneered the concept of formal education for nursing. She served the injured soldier during the Caribbean War, which strongly influenced her philosophical aspects of nursing. That is, philosophical aspects. She'll be able to philosophize, flashback about her calling. In 1859, she published her view in nursing care. Is noted on nursing. She considered the first nursing theories. She started in her nursing, noted that she is the act of optimization and utilizing environment of patient to assist him in recovery. That is, she stated that patients need to environmental aspects help patients in to recover fast. Her contribution during that time was that the war is well known. She was a statistician. Statisticians in form of the person that can draft things in statistical data using bar charts or pie charts, highlight the key points. Statistical data, that is a formula that she used to fish out some points that she'll be able to use to treat people in some mathematical way. International Nursing Day was formed by Florence Nightingale by she every May 12th, May Day. Every May 12th is observed in respect of her contribution of nursing, and she died August 13, 1910. The foundation of Nightingale's theory is the environment all the external conditions and the focus and the development of an organism. According to her, external influence and the condition can be prevented, supported, and contributed